My name is Nakeshia Harris, registered nurse, and today I'm going to do an assessment of the eye. I'm going to look at his eyelashes, his eyebrows. The hair on them should be evenly distributed. It should be well aligned. When I ask him to raise and lower his eyebrows, they should do it symmetrically with no problem, and of course they did. His eyelashes should be curled slightly outward, and of course they are. His eyelids should not have any discharges or discolorations, and they should close symmetrically. And there should be involuntary blinks of about 15 to 20 per minute. If you notice, the patient is blinking, and it's just involuntary movement. It's nothing that they can do to control it. Normal, like I said again, is around 15 to 20 per minute. When I look at his eye, his conjunctiva should be transparent, and there should be very few capillaries noted. The sclera should be white. The conjunctiva, of course, is shiny and smooth. There should be no tearing or edema of the lacrimal gland, and his cornea should be transparent, smooth and shiny. His iris should be flat, round, and blinking should be noted when we touch his iris. The pupils are black, of course, and they're equal, and they should they should respond to light accommodation equally. And we know that it's PERRLA. Pupils equally round respond to light accommodation. They should constrict when he looks at something that's near, and of course they should dilate when he's looking at an object that's far away. His pupils should converge when the object is moved towards the nose. We're also going to check his peripheral visual field. We want to make sure that he can see objects in the periphery when he's looking straight ahead. And then, of course, we want to make sure that the eyes coordinate and move in unison when we're checking for the extraocular muscle. I'll go ahead and do the ophthalmic exam. And I'll take my ophthalmoscope and turn it on. And I'll begin looking at his eye. Okay. Close your eyes, please. Any tenderness?
No.
Okay. Then we'll check the 6 cardinal fields of gaze. And we'll make sure that his eyes are reacting to light. Okay? When I move the light, you do your eyes in the direction of the light. Then we're going to test to make sure that his pupils are constricting and dilating appropriately. And that one, of course, did. And that one did as well. So from the assessment of his eye, and based on my assessment, I didn't detect any abnormalities. There's no edema, there's no tearing. When I looked into the eye, the structures of the eye, they all look normal and within normal limits. So if I was going to report this to a physician, I would tell him that Mr. Harris's vision is within normal limits. And of course, we'll do the Snelling chart as well. We look at, when we do the Snelling alphabet chart to test for vision, that's what most doctors' offices use. What we tend to do is look at the denominator. The higher the denominator, which is the bottom number, the worse your vision is. And we base it on a scale of 20 usually. Try to put that scale 20 feet from the patient. And within that 20 feet, that's what a normal person could see at 20 feet. So for instance, if the Snelling chart said 20 feet and Mr. Harris can only read it at 25, his vision would be 25-20, meaning that he can see at 25 feet what others could see at 20 feet. And that concludes the assessment of the eye.